Family of the late Deputy CEO of the National Entrepreneurship Innovative Program, Stacy is accusing owner of Obengfo Hospital of having a hand in her death for failing to inform the family 3 days after her demise. Stacy died under mysterious circumstances after visiting the facility for a medical checkup. Mother of the deceased, Nana Akosia Enima I, is questioning the swift action by the doctor to embalm and deposit the body at the morgue within 3 hours after her death.
The ban on Yari, Papa, what brain out of Commitana or Catherine, what thrown in social or just what bread or dry.
My daughter was not sick. She said she was tired and needed some rest. So I suggested to her to put her phone off and rest. She should go to the hospital for a checkup too. I believe the doctor has a hand in her death. Even if the person is dead, you look for her relatives within 24 hours before taking the body to the morgue, because she might even be in coma. Her phone was there. We were all calling, and they never answered the call. I got to know of her death on Wednesday. I suspect the doctor because after her death, he embalmed the body quickly, making it difficult to establish the cause of death. He doesn't want people to know the poison he used on my daughter. And please, he wasn't there for body sculpturing.
Monday now, 12 o'clock now, or 1 o'clock now. I'm more 5 o'clock now. Papa Yatinia, I'll buy. I did not cost fridge. I thought I drew the abandon and teachers I poison now, or the war now, or the farm, not as I draw now, or the abandon in the womb. Oh, quiet post meeting now, and you know, and only idea, maybe suspect because on Yari, one could only your fluid.
Meanwhile, a former director of the Ghana Health Service, Professor Bedu Akosa, is calling on the Medical and Dental Council to take disciplinary actions against owners of the hospital.
Embalmment is a request from relations. It is not automatic that, unless you've got something to hide, of course, that as soon as somebody comes dead, you immediately embalm the body. No. The embalmment is at the request of the relations who bring the body. Then, as far as I'm concerned, this is flouting the etiquette of professionalism. This is going against ethics of any profession. If there are professionals involved, then, straight away, the professional body must review and discipline them. I cannot prescribe anything, but it is for the Medical and Dental Council in this instance to take the appropriate action.
We have been speaking to the Medical and Dental Council on the happenings.
I would wish I was silent on this particular issue because the case is with the police, and I am sure during your investigations you may have noted that that particular institution was closed down on 2 occasions and it was reopened. And then that case is currently with the police, and they are doing their investigations as to why the institution should be reopened without recourse to the provisions or without recourse to the laws of the nation.
But they operated in those times that we were waiting for the police to finish investigations?
In the next couple of days. Pardon?
I'm saying that the hospital was operating at the time and people's lives were in danger whilst the police was investigating.
Yeah, you see, the issue is that the Medical and Dental Council took certain actions based on some information that we had received. And for that action to be legalized, we really had invited the police to come in. So eventually, with the closure of that particular institution, we did that in conjunction with the police for them to be able to do their investigation. I do know that the institution was reopened, whether legally or illegally, and then again we had closed it. We had caused that institution to be closed a second time, and it was reopened. And as I'm saying, that case is still in court and for the final determination as to why an institution which was closed down by a regulator should be reopened without recourse to the provisions in the law.
Dr. Sipui, even before we did our investigations, we understand that the Obengfo Hospital's license had been revoked. Does he have a license to operate now?
Well, as we speak now, Dr. Obeng Ando does not have the registration to continue to practice as a doctor. I will provide some information to the general public understanding of the provisions in our law. In 2012-2013, Dr. Obengfo appeared before the disciplinary process or went through the disciplinary process of the Medical and Dental Council. He was found guilty and he was suspended for 3 years. Now, then he filed an appeal. And per the provisions in our law, once a practitioner files an appeal at the Court of Appeal, it serves as a stay of execution. Now, since the appeal was filed, and then it serves as a stay of execution, Dr. Obengfo could continue to practice until the appeal is determined. However, the practitioner is supposed to renew his registration every year to enable him continue to practice. Unfortunately, since then, Dr. Obengfo has not renewed his registration to hold himself up as a doctor.
Are you aware that he was still operating as recently as last week?
We are aware, and we have made a series of complaints. Currently, as we speak, there is a case ongoing being investigated by the CID of the Ghana Police.
And you complained to the police, and I'm trying to understand this. You complained to the police and he was working. People were going there, their lives were in danger. Dr. Sipui.
You see, I would wish that we understood the system quite well. The Medical and Dental Council had the power to close down an institution for a particular level or for a particular time. Thereafter, everything has to be done by the law enforcement agencies. Even in the first instance, we went there with the law enforcement agency, with the police, CID, to get the place closed down. The place was reopened. Now, again, the second time we went, and there were issues. If you had really followed up, you would have noted that at a particular time, we even sent an ambulance from 37 Military Hospital to evacuate any patient that was in there for the safety of the patient so that we could close down the institution. The patients who were in there had indicated that they were not going to leave. So invariably, we had to lock the entrance and allow them, those who were healthy, those who could leave, for them to leave. So basically, I'm stating that, yes, all these issues are being considered by the investigations unit of the police CID, and then eventually there will be a final determination. Because I wouldn't want to go into all this, because the case is now in court, and I wouldn't want to be charged for contempt of court. So I'll be a little, I'll be silent on a number of issues with respect to this particular. He's continuing practicing as a doctor.
Yeah, we understand, Dr. Sipui. And so finally, what's the way forward from here? And what would you say to any persons who would want to go to the hospital after today?
No, we have made our position clear over and over that in the first place, even before all these things started coming in, we made our position clear as a regulator, as a Medical and Dental Council, that Dr. Obengfo has no valid license to hold himself up and practice as a doctor. And anybody who goes there to seek medical advice does so at his or her own risk. We have made that clear over and over.
Staff engaged him in wait for an absentee doctor.
Police has launched investigations into the matter. We'll bring you updates later.